everyone. Thanks for tuning in to wellness.com, where we bring you expert health advice. Today, I'm in the company of Dr. Anna Chacon, and she's a specialist in dermatology. Welcome to the program, doctor.
Thank you. Thanks so much for having me.
Right at the outset, can you give us a short description about what you do and what your areas of specialties are?
Sure. I'm a board certified dermatologist, and I specialize pretty much in all aspects of dermatology, general, cosmetic, surgical, and I also do a lot of teledermatology.
So let's start off by understanding the skin. Now, not a lot of people know this, but the skin is actually one of our vital organs. Am I correct?
Yes.
Why should we care more about our skin?
The skin is the largest organ of the body. It's very protective. If you think about it, it's kind of like our outer shell. So pollution, sun damage, substances, chemical substances, things in the environment like wind, heat, cold, these are all regulated by the skin, and we need it. So you can. That's why having a burn is such a big deal, and people die from it, because that barrier is disturbed. So it's really what you put outside to the world, and what protects you from most insults in life. And it's also what people see first. So as opposed to, there's other organs in the body that are very important, the heart, the lungs. It's hard sometimes to tell if there's any issues with these organs because they're very internal, they're hidden from view. And with dermatology, if you have a problem with your skin, usually it's going to be obvious to the community, and everyone around you is going to know it. So those are the reasons why you should take care of your skin.
So I want to touch on the word skin cancer. We hear it a lot. Could you tell our audience what is skin cancer and what are some of the visible signs that we should be looking at?
I know my patients often ask me the same question. Typically, something that does not go away is suspicious. So, a growth that continues to grow and is just growing and growing and not going away, you're going to want to remove it. You're going to want to biopsy it. The first step in evaluating if someone has a skin cancer, a patient can't determine that themselves. They have to go to a dermatologist typically and get a biopsy. And the simplest biopsy to do is going to be a shave biopsy, where it is exactly what it sounds like. You numb the area and then you just shave a piece off and send it to pathology so they can look at the cells underneath the microscope and determine what it is. Skin cancer is the most common cancer in the world. There's nothing more common than a basal cell. That is the most common type of skin cancer. And while that's bad, the good news is that you can just cut it out in most cases and get rid of it. So if you happen to have a very small one, you can even sometimes get rid of it with a biopsy. If you let things go, like other aspects in medicine, things become much harder and challenging to treat. There are ways to treat skin cancers that vary. So surgery typically has the highest success rate, but there's also radiation, which we use in a lot of elderly patients that don't want an operation, or they're afraid of, or they just cannot tolerate anesthesia, or it's in a cosmetically sensitive area. There's creams that you can use to, like chemotherapy creams that cause a significant inflammatory reaction in terms of trying to get rid of the skin cancer. They can cause a lot of inflammation, and sometimes you can even use cryotherapy, which is a cold spray with a lot of force to get rid of a skin cancer. It creates a blister and then it can get rid of it that way.
At what age should we start coming to see a dermatologist, or is age a factor at all?
Yeah, so a dermatology appointment should be at least once a year. If you're over the age of 50, let's say you have nothing wrong with your skin and you're over 50 years old, it should be at least once a year. Um, if you are not over 50, but let's say you have a family history of skin cancer, you should still go in if you notice something new or you just don't know what something is. So I have patients that say, oh, I just don't know what this is. Okay, well, there is no way for me to tell you on a podcast or over the phone or even through a virtual that I can guarantee this is nothing bad. You're going to have to get it checked out, you know? So that's what I would say about that, because it takes years and looking at thousands of skin lesions. And even then, sometimes dermatologists are not correct. Nobody's perfect. And also, there's a lot of liability with things like melanoma because sometimes they don't even have to have pigment, and of course they grow very quickly, so they can appear overnight and eventually be untreatable in some cases, things like that.
Having skin cancer, is it deadly?
It can be, yeah. So people have passed away, although in very rare instances, from basal cell carcinoma because it can encroach on surrounding structures. And usually that is people who, wait very long to get something taken care of. Squamous cell is more aggressive than a basal cell. It's another type of skin cancer. It's the second most common. And that can metastasize to lymph nodes. It can spread to other areas. Squamous cells are also, they can appear in other organ systems. They don't have to be in the skin only. They could actually appear elsewhere.
What areas of the body are most susceptible to the skin cancer?
Yeah, so typically sun exposed areas. So areas where people are basically exposing themselves to the sun. So face, nose, and not just anywhere on the face. It's typically forehead, nose, cheeks, chin, ears are a big one, especially if you have short hair like yours. Um, the sun rays are going to hit the top of your ears. The scalp in patients who have hair loss or very little hair is going to be an area where you see skin cancer. And then the back of the hands and also the upper chest area as well.
Well, that was informative information. I appreciate the insight. And if anybody wants to know more about this subject matter, how can they reach the good doctor?
Thanks. I have a website, drannachacon.com, and I'm licensed in all 50 states, Guam, DC, and the Virgin Islands. So I can see people in all those areas. If you live overseas, we can do a second opinion, especially with another physician there. But we also can't directly prescribe because you'd have to be licensed in that country.
Well, this is great. It opens up the opportunity for collaborations worldwide.
Yes, it does. Mhm.
Brilliant. Well, thank you for your time. And thank you for watching another webisode on wellness.com where we bring you expert health advice.